You've probably heard of an electrocardiogram, or ECG, but have you ever stopped to wonder what it's really telling us? Well, today we're going to demystify this super common test. We'll explore how it basically acts as a translator, letting us listen in on the secret electrical language of our very own hearts.
Think about it this way. Every single time your heart beats, it's sending out tiny electrical signals. It's like it has its own unique voice, constantly broadcasting its status. The real question is, are we listening to what it has to say? And that's where the ECG comes in. It's pretty much the ultimate translator. This simple, non-invasive test picks up those weak electrical currents your heart is already producing and turns them into a visual waveform. And that waveform, that's basically the language of your heart, made visible for doctors to read. So when doctors are looking at all those squiggly lines, what are they actually searching for? It's not just a bunch of random noise. There's a real predictable pattern there. And the true power of this test is in spotting when that pattern is broken, when something just looks a little out of the ordinary. See, a healthy heart produces a really regular, predictable electrical pattern. So any little deviation from that normal rhythm is a signal. It's kind of like an early warning that something might need a closer look. Basically, the shape of that wave is telling a story about your heart's health. And wow, what a story it can tell. An ECG can give us clues about a whole range of conditions. We're talking about really serious stuff, like a heart attack, what doctors call a myocardial infarction, or an irregular heartbeat, which is known as arrhythmia. It can also point towards things like inflammation, electrolyte imbalances, or even physical changes to the heart's size and position. It's just a vital first step in diagnosing these potential problems. Okay, so hearing about all these big medical terms might make the test itself sound a little scary, right? But the reality is actually the complete opposite. Let's walk through what really happens during an ECG so you know exactly what to expect. Maybe the most important thing to know is that this test is completely safe and totally painless. You feel absolutely nothing. It doesn't hurt, it won't itch, you won't feel any numbness. It's just a passive recording of what your heart is already doing on its own. The whole process is incredibly simple. You just lie down comfortably, and a technician will place a few small, sticky sensors, they're called electrodes, on your chest, arms, and legs. Then all you have to do is lie still and be quiet for a couple of minutes while the machine does all the work. That's literally it. Now, to get the most accurate results, there are a few simple things you can do to get ready. And don't think of this as a list of strict rules. Think of it more as your personal checklist for helping your doctor get the clearest possible translation from your heart. And there's a good reason for each of these. Staying calm and still is pretty obvious, right? We don't want your muscle movements mixing in with your heart signals. Metal objects, wet skin, or even something like pantyhose can actually interfere with the electrical reading. And avoiding exercise just makes sure the test captures your heart's true resting state, giving a nice, clear baseline. And to be even more specific, here's a simple timeline for that last hour. About an hour before your test, it's best to avoid any stimulants. So that means no smoking and no caffeine from coffee or strong tea. These can temporarily speed up or change your heart's electrical activity. It seems small, but this little bit of prep makes a huge difference in getting a quality reading. All right, so the test is done. Now what? Let's talk about what those results really mean for your health. And this is where context is absolutely everything. The first thing to get is that a standard ECG is like taking a single photograph. It's a snapshot in time, and it's taken while you're at rest. Now, while that's incredibly valuable, it does have a limitation. Some heart issues only show up when the heart is under stress, like when you're exercising. So a resting ECG might not catch those particular issues. So when you get the results, what's the right way to think about them? Well, if your ECG comes back normal, that's fantastic news. But it's not a free pass to just ignore your health. It's just one good piece of data. On the other hand, if it comes back abnormal, the first rule is don't panic. Think of it as valuable information. It's the first step that lets you and your doctor figure out what's next, whether that's more tests or a treatment plan. And that really brings us to the main takeaway here. An ECG gives us one vital snapshot of our heart's health. It's an absolutely essential piece of the puzzle. So the question I want to leave you with is this. What are you doing to monitor all the other pieces to really understand your heart's complete story?